everyone. Welcome to this episode of Entrepreneur Showcase Series brought to you by Patranya Media LLC and Parkway Media Partners. I'm your host, Patranya Poonswan, and I have two very special guests in the studio with me today. We have two great doctors here in the Las Vegas area. We have Dr. Sid Khurana, and also we have Dr. Tim Jeider. Got that right?
Yes.
Okay,
Thanks
perfect. Thank you so much for being here. And you're both from Nevada Mental Health, which is the practice based right here in Las Vegas, Nevada. And you're both double board certified child and adult psychiatrists. Is that right? A lot of titles there. And you're doing great things for the community. So I'm so happy to have you both here. Dr. Sid, why don't I start with you? Talk to me a little bit about Nevada Mental Health. This practice has been around for a few years, right?
Yes. So this practice came about when somebody asked, hey, I need to go myself or take a family member or my child to see a psychiatrist. Where should I go? And the question was, how are you going to pay for it? If you're uninsured, there are good options in town.
Right.
And if you have a lot of money and you can pay out of pocket, there are good options. But if you are in the vast majority of the 80 to 90% of the population where they rely on their health insurance to get good care, we could not think of an option where we could send friends and family members or acquaintances to go get care.
Yeah.
And that's where the idea and the vision was put together to start a clinic which can serve and meet the needs of this community, where people can use their insurance but get the care as if they were paying self-care, out-of-pocket psychiatry.
So obviously the need was out there, but there's not enough places to meet those needs for people who rely on the health insurance, right, for this type of care. And so this practice started, you said, 2016?
Nevada Mental Health as a practice started 2018.
2018. So it's only just been a few years. And Dr. Tim, you came on board. Was it right when it opened, or?
Yeah, so we were working together when we launched in 2018, and I think our doors officially opened for our clinic. The first patient was just after the new year in 2019.
Wow.
And so that was a lot of fun building from scratch, because we just opened to the public and people started coming in.
And you both have practiced elsewhere, obviously. And where did you practice before? Here in Las Vegas? Dr.
Yes,
Sid? Yeah.
I have practiced here in Las Vegas, and prior to that, I was at University of Virginia.
Okay,
UVA.
perfect.
I'm a UVA graduate.
And you have been in California, but how long have you been here in Vegas?
So I've been here in Vegas since 2016, and so I came here to finish my training with the Child Adolescent Fellowship, which gives you the certification for that population. Got here 2016, finished that midways through 2018, and then shortly after is when we launched Nevada Mental Health.
And I think you're starting it at such an interesting time. I think, just mental health in general, but you just started right before the pandemic started, and I think that's really kind of key. And we'll talk a little bit about how that affected your practice and what happened because of that. But also, I think what makes this practice stand out, and what you just told me, which I think was really interesting, is you're the largest child psychiatry practice focused in the state of Nevada, right? Right here at your practice.
That is correct.
Yeah.
We have 7 child and adolescent board-certified psychiatrists, which is by far the largest child and adolescent psychiatry practice in the entire state of Nevada.
And that's because in the entire state of Nevada, there are a total of 20. So you make up almost half of those
we
professionals.
We are 7, hopefully going on to 10. We are the largest practice in town.
I mean, that sounds kind of crazy, but is that normal? I mean, I know the needs are out there, but it seems, like we need more than this, right?
I think it's unique in the sense that, like I said, we're the largest constellation of child adolescent psychiatrists who've come together in a single practice.
Yeah, I mean, it's great that you guys are here, but I feel like there should be more, obviously, right? Yes. I mean, the needs are out there. Yes. And how have you been seeing, since you started the practice here, have the needs just been growing, especially in light of what happened in the last few years?
Yeah, I'd say we're constantly trying to keep up with demand. And that's part of our kind of mission for the group, and our dedication to the community is recognizing there isn't enough of us. So we're involved in the training programs for the coming up generations of the next child adolescent psychiatrists and even adult psychiatrists. So we're involved in the training programs throughout the valley to help teach what we do know and spend time focusing on the qualities we value and how we do our practice as opposed to, other ways of doing it.
And Dr. said you work with, even though you're dealing with child psychiatry, but you work with patients of all ages.
Yes.
So talk to us about that, some of the services you offer and what really makes your practice stand out, not just here in Las Vegas, but just in the entire state.
Yeah, we like Tim was saying, we train psychiatrists, both adult and child, so hopefully we want to have them find a reason to stay here, work with us. We recruit from outside the state. We basically want a constellation of like-minded people who value quality patient care. Patient care comes first. If our patients get better, that's what makes us sleep better at night.
Yeah.
And we want to wake up a day when our job is not needed. No child psychiatrists are needed. Unfortunately, we have a long ways to get there. But we specialize in treating children and adolescents as well as the conditions that don't go away when those children and adolescents become adults. So things like ADHD, autism spectrum disorder, fetal alcohol syndrome. People live with those conditions, and we want to have adult psychiatrists who know how to recognize them, those conditions, how to treat those conditions adequately, so we can diagnose correctly. Diagnosis is important in mental health treatment.
And how young do you start with children at your practice?
My youngest is a 2-year-old.
Wow. For mental health? That's scary. I mean, but is this something that they were born with and affected them physically, that impacts their mental health?
Yeah, so even I've had infants in my practice. The idea of attachment starts to develop when the babies are born, and the parents' bonding and the baby's attachment, and that work that needs to take place early on. But we see 2.5-year-olds with a lot of hyperactivity, impulsivity, extreme tantrums that are beyond what should be explained by the terrible twos. And there is a lot of work that goes on the parenting end and how to recognize, how to manage. And I do want to clarify, when we say we see very young kids, treating young kids is not the same thing as medicating young kids. We prefer not to medicate young children. We prefer to treat them, help them identify what the problem is, and help the family come up with a treatment plan that doesn't have to rely on meds, but can rely on other treatments that can bring the family together.
Yeah, it's such an important issue. And Dr. Tim, talk to us a little bit about, this becomes not just treating the kids when they're that young, especially, the whole family comes into play, right? And you guys have to be kind of an expert in a way of dealing with that dynamics of bringing the family into the practice as well.
Yeah, so I would say it's looking at it as not just mental health, which is we're kind of guilty of doing with our name, Nevada Mental Health, but it's behavioral health as well, particularly when you're dealing with younger folks. What are the behaviors that are going along with the kind of internal mental and emotional struggle? And you have to build treatment plans that affect someone's life, right? And so I use the example with adults, if someone's in, say, a domestic violent relationship, and from that they're having PTSD or depression, and you say, well, here's a medication that should get you feeling better, but you don't do anything to address the environment or the circumstance where the day-to-day behaviors that are related to living in that environment, the odds of you getting to a successful outcome are pretty low. And so our practice likes to make sure we've taken that zoomed out approach and making sure we're getting the whole life, which is particularly important for young folks and for kids and adolescents, because it's the context of their family, their friends, their school, extracurricular activities, what's their entire community that they're involved with, and how are they functioning in all of these spaces, and what sort of treatment interventions do we need in all of these places. And that's the approach we like to take, which I would say does take time. The unique thing about us is we value that because it takes a meaningful, in-depth conversation to get to those details and understand that picture. And so with the shortage that we referenced earlier, it's, I think sometimes people build models that, play to that as there's not enough of us, here's some meds, find these other things other places. We took that step back and said, let's figure out how to build a practice that can survive on providing that time it takes to do that, and look beyond just being a quote-unquote prescriber, but really come up with a well-rounded, multifaceted treatment plan.
Yeah, and it's interesting what you do, because I know the needs are out there, and Are you seeing, and Dr. Zed, I think this is kind of interesting, just thinking about the trends, because you've been in this business a while, but is it changing the way that, with stigma when it comes to mental health? Are parents more willing to approach you both as professionals now and say, I think I may need help for my children, as compared to like maybe 10 years ago?
I would say so. I think the needle is moving. We still have ground to cover, but more and more families are becoming more open, more receptive, less stigma, but also, unfortunately, the stress and the prevalence of psychiatric conditions is increasing. The disease burden is increasing.
Right.
So there is a much higher need. So I'm glad that stigma is getting better. Otherwise, there would be a huge amount of unaddressed mental health disease burden out in the community. And I do want to say, I think Tim hit it really well. We value taking our time and spending time with patients and families. I think that is the one core component of a good relationship. Sometimes my patients or family members or friends will ask, what is it that is something that's very important?
Right.
And I would often say, go figure out if you have the connection, you have the rapport. And time is not the only component, but is a very important, essential component.
Yeah.
I need to spend time with you to get to know you, get to know your struggles.
Right.
So we are a practice that is not quick to take out the prescription pad and here is your prescription. Pills don't teach skills. So we want people to learn the skills and use medications if and as needed to fit into that puzzle piece.
And I really like hearing that because, I personally, if I don't have to take any kind of medication, I wouldn't. I'm that type of person. I would think as a family, as a mom and dad, you think about that as your kids too. You want to make sure that you kind of go around that and treat it as each individual case. But, we're talking about this. One of the reasons we're doing this story is May is Mental Health Awareness Month, right? And it gets people talking about this issue, which I think is really important. Talking about stigma, and Dr. Sid, maybe talk a little bit about that coming from, minorities. And I've done stories on this, me being Asian Americans, a lot of people in the Asian communities really, we grow up thinking mental health is not something we talk about. This is not something to be fixed. It's something that just goes away. Is that something you see maybe in some portions of the patients that you do see as well?
Oh, absolutely. I think there are so many cultures where mental health is still stigmatized and it's not okay. It's considered you're weak. If you have a mental health problem, you might have high blood pressure or diabetes. You'll get all the empathy and support from the family. But if you're depression, why is that?
That's not a real
That's not
problem.
okay. That's not a real problem. Just cheer up. If you have ADHD, just start paying attention. If you're sad, just don't be sad. And we know feelings don't work that way.
Right.
So we train our team to be receptive, and that starts from the very first phone call our intake coordinator takes. When a minority person calls, it has taken a lot of effort and courage for them to take that step to make that phone call.
Yeah.
And we want to be as receptive and as welcoming of an organization, a welcoming place, so that they feel welcome and they feel heard and they feel like we are attuned and sensitive to their unique needs. And then be mindful of how they would like their treatment to be proceeding.
And just having people from different backgrounds, right? I think at your practice that I know you speak Hindi, Spanish, English, right? Different languages and I think that's part of breaking down those barriers, right? For different groups of people calling and getting help. And I know technology becomes a barrier too. And Dr. Tim, you can talk a little bit about that because you started the practice just before the pandemic. But I know even before the pandemic, you already started telemedicine as part of your practice. And why was that so important at the time for you?
I remember specific conversations we had about that, and there were certain components of our business that were on telemed platforms, but it wasn't the majority of it. And I remember our own internal debates about, is it growing, is it not growing, what direction we are to go. And I think it was amongst all the voices we had that we were talking to was kind of split. And then COVID happened and kind of made a decision for us. And I'd say less than 2 weeks, we were almost entirely digital.
Wow.
So it was certainly a catapult into, I would say, the future of telemedicine because it's been more widely adopted. And it's been an interesting process, and I would also I had a few thoughts on going back to looking at dealing with the different minorities and cultures, and even we talked about earlier, Sid, the diagnosis component and how that relates to stigma. I think in part because of some of the things we've seen during COVID, stigma has changed quite a bit. And I would say in the young folk, younger generations more so than kind of the parental generations, which when you look at kids, you're treating your child or teenager, but an integral member of that treatment team is the parent. And so you have, not only do you have to look at, backgrounds of the families, but also now the generational difference. And there's been some almost shift in stigma where the fidelity to diagnosis is so important, because I don't know if you've seen this, Sid, some young folk, they now want a diagnosis. And so there's some things that might seem like normal developmental process that's challenging and difficult. And you have young folks showing up and be like, well, this must be a mood disorder. And it's like, is it not? And particularly then put that in the context of an older parent who's like, my kid just needs to learn some stuff. Right. And the kid's like, no, it's an illness and you're not validating me. And you're just layering all these different complications. And so that process, again, is one that's, I find it fascinating and challenging, which is probably why I got into doing the child piece.
And I'm sure all the changes are happening, and like you said, how maybe a lot of the kids, even teenagers, are getting a lot of their information online, what they hear on social media, and like celebrities coming out and talking about different kinds of mental health issues, and that's happening a lot more. A lot of people self-diagnosing through Google or whatever, but is that helpful? I mean, is that a good thing, Dr. Sid, that more people are talking about it, whether or not it's accurate information, or is it too much? And what's your thought on that?
Yeah, when you read up on stuff, what you're getting is the information. You don't have the context to convert that information into knowledge.
Right.
And that's where going and talking to one of us, putting that thing into a context of your life, of your culture, of your background, and seeing whether it's a disorder or is it a slight struggle, because there is a fine line between. When I was a med student, every chapter of the book I would read, and we would all say, yep, I have that, I have that. So it's a very common thing for people to read things and say, I think I have that, I think I have that.
Right.
And not to be dismissive of that, but if that concern persists in your mind, that's where we say, come talk to us.
Yeah.
We don't have horns growing over our head. We're nice, friendly people.
Yeah.
It doesn't hurt to go talk to somebody and clarify if you have any questions.
Well, I think this maybe bring up a point, and I know it's on your website just to clarify things but I think a lot of people, including myself, still kind of confused about the different, psychiatrists. You guys are both psychiatrists, but there's also psychologists and therapists, right? So what's the difference there? Are you guys, how can we as, patients, consumers, understand and make it helpful for us?
So the broad scope difference between them, well, first the commonalities, right, is we're all mental health providers. I have friends in every camp of background and training, so I'm sure someone will take umbrage with how I describe this, but the easiest way to look at it is therapists, counselors, you're going to get your more talk-based interventions, right? We sit down, have my 45 minutes to an hour to talk about it, work on skills, there's workbooks, there's all kinds of different talk-based therapy. Psychologists are in that realm as well, but I would say, and nowadays are mostly gravitating towards testing, and so they're the ones you might get more like your neuropsychiatric or psychoeducational testing. So they do more of that in their realm, and on our realm, I say we kind of do a little bit of everything, a little less testing, but we do our screenings. I certainly. The reason I personally also don't like this kind of breakdown is it kind of leaves physicians or psychiatrists as the people who could write prescriptions. So that's where people think of us as the prescribers. We do the pills.
Right.
But that's my take on it is if you take that approach as my job's just pills, go talk to someone else about your feelings.
Right.
I think you're really missing what psychiatrists do. And I think in our spot, we end up being almost kind of like a quarterback of the team, where you have different players who have different skill sets, but or even the coach, who's the person who sits back, sees the landscape, and can figure out, do you need this service? Is it, BST, PSR, CBT, you need a group. But we're also the ones who, when you look at it, help figure out, do people need to be in hospitals? And so we're the folks who are usually in charge of those teams as well.
But in your clinic, in practice, is it just psychiatrists at your
Yeah, so
practice?
we are a group of psychiatrists, even though we highly, highly encourage therapy.
Yeah.
And I would say that was very well explained. That's one of the better jobs I've seen in explaining the differences. If I may add to that, to color that picture, I would say with psychiatry comes the medical model. So the psychiatrists have gone to med school
Right.
and have gone to residencies and fellowships. So we view things from that holistic, but
Yeah.
from a medical framework.
Right.
So when seeing a psychiatrist, you're going to make sure your electrolytes, your thyroid, your other medical problems,
Yeah.
which might on the surface look like anxiety or depression, but inside are actually medical problems. So we are not only dealing with primarily psychiatric conditions, but conditions that look like a psychiatric condition, but is on the back end
Yeah.
a medical condition. So that's where it is another area where we is the approach, the model that we work under.
Yeah. And so, I mean, I guess one of the big questions that a lot of people ask themselves, or maybe come and ask you both, is like, when is the right time? When do I need help? You know, is this something that's serious enough? Or do all of us at one point in time need to talk to someone like you? Well, how would you answer that?
So, on the most general sense, I think everyone's got something they're working on.
Yeah.
I would encourage folks, if you feel like things just aren't clicking, you're trying and or even if you can't even have the energy or efforts to try, really just stick with that. If life just isn't going the way you think it should be and you can't quite figure out why or what those stumbling blocks are,
Yeah.
it's helpful to reach out. And I like our practice because I think some of the hesitation is they don't just want to go see someone and say, hey, I'm feeling a bit sad. And they're like, oh, you have depression. Here's a Prozac. Thanks. And then they don't really have any new understanding or answers to what's
Right.
going on. And that's what's, I think, different about our approach is we're happy to help people figure out what's going on. Because sometimes you don't know and sometimes it's nuanced.
Yeah.
And so if you just aren't, you know, if it's just not going the way you think it should be, asking for
It doesn't
help
hurt
doesn't
to
really
ask,
hurt.
right? It doesn't hurt.
Yeah, I would say if the
Yeah.
thought has come into your mind,
Yeah.
it is time.
Yeah.
A stitch in time saves 9. Right? So the best kind of resource, money or time spent in a doctor visit is you go and they say, you're okay.
Right.
And you rather be on that side of the things or let it simmer for too long and then say, gosh, I wish I had seen you a year ago.
And it doesn't have to be something that's extended long time, right? And for a 30-minute visit, you
Yep.
can probably get a lot of answers.
A 30-minute to an hour visit,
Yeah.
and you can have your preliminary queries answered, and then you know you're fine, keep doing what you're doing, or tweak a little bit, or actually we need to meet more often.
Yeah.
And that's the kind of dialogue and conversation we hope to bring to those encounters where someone shows up and says, or I usually start with, what is it that brings you in, right? And someone says, well, I'm not really sure. And then you just kind of start the conversation, and the first portion of that's built on getting their sense of what's going on. It's through
Yeah.
guided questions, and, you know, as they report different things, you know, in our heads, all the little things are ticking away, kind of, you know, figuring out and going through our different evaluation process. And we kind of help guide those questions and guide that conversation. But then near the end, there's that feedback part of kind of like, you know, here, let me tell you what I feel like this is what I've heard you talk about and describe. Here's what that then means from a diagnostic standpoint. So there's that education about here's why I say what's going on as best we can. It's sometimes a moving target, and a first conversation to be like, boom, stamped, here's your diagnosis, written
Yeah.
in stone. You know, sometimes it's an evolving process. But you get that dialogue and explanation about what's going on, and then so you kind of turn the story into a diagnosis, and then that sets the stage for here's the recommended treatment plan. So these pieces fit together, so you have actual answers as to what's going on, rather than just I said some stuff, I think they listened,
Yeah.
and then they gave me a pill. I remember people I've seen who've been in mental health treatment for years, and they're like, no one's ever told me my diagnosis was depression before, and I'm like,
Yeah.
okay, and I'm like, well, I'm glad we had that conversation, and that's what we really enjoy.
Yeah, and it can be life-changing. You know, just a short conversation with either one of you or one of your, you know, psychiatrists at the practice. But, I mean, Dr. Sue, what would you say is the biggest challenge that you're facing right now as someone in your profession? I mean, obviously you're dealing with a lot, but what would you say would be the biggest one for you right now?
Gosh, that's a really good question. I would say our biggest challenge over the last few years has been changing the microculture of our community. That has been the idea that there is no quick fix.
The way that we think about mental health, right?
Right.
Yeah.
So you're not going to be handed a prescription almost in the waiting room, but when you come in, we are going to be sitting down, we're going to take our time, we're going to talk.
Yeah.
And
there's no quick fix.
there is no quick fix.
Yeah.
Unfortunately, in mental health, there is not a scanner that you go through and you come out and you're all fine.
Yeah.
So there is the work that gets put into via the talk,
Yeah.
and then blood work or meds or not meds or only talk therapy. Getting our micro community here in Las Vegas and Nevada in general to accept that just somebody giving you the prescription, just somebody looking you in the eye within 2 minutes of seeing you and saying, I know what you have here, this will work for you, is not the right way to practice.
Yeah.
And I think that has been our struggle, and I think it has been very rewarding because we are seeing that change. And now people are so appreciative because people are getting better.
Well,
Less and less of our patients are getting hospitalized.
Yeah,
less and less of our patients
that's
are on
good
multiple
news.
meds. And this is how we would want our families to be treated. And it is good to see that our Las Vegas community is being treated that way.
And we need to talk more about this. And I'm glad we're having this conversation, getting people to just say that this is an issue. This is something that affects kids very young to someone very old, right? Because this affects everyone. And mental health just kind of get thrown out there. But, everybody has their own, right? You see patients of all different backgrounds and come in with all different kinds of issues.
Yeah, everybody's got something, and it's also the unique experience each person have, right? So there's, I think, 3 of us sitting in this room. An event can take place, and then fast forward 3 months later, and we ask each of us, hey, what happened in that event? And all 3 of us might have a different perspective on what actually happened. We remember it differently, have different emotions associated with it, and we can all walk away with different experiences from that. And so the unique journey someone has, just because it seems similar to someone else, doesn't mean something hasn't gone awry per se in your own experience. And that's the unique approach that you have to take. It's, there's a diagnostic manual for psychiatry that I say you can't really boil everyone down into just the list of criteria and symptoms, right? You have to have context and extrapolate that into what does that mean for your life, and how does your treatment plan work for you? Because if it was just as easy as I get sad and, well, here's the pill, that was the answer. I mean, primary care would take care of mental health overnight, but it's way more complicated than that. And everyone from everywhere has got something. And seeing us kind of get out of the stigma of not talking about it, any sort of conversation at least starts the conversation, and then you can get to where you need to go from there.
Yeah. So what's next? I mean, for this field and for what you're doing, especially here in Las Vegas, what do you foresee? And what do you want to see in the field of mental health and what you do?
Well, we would want to see what you had said, less and less stigma, more easy access. So our goal every day is to break down barriers.
Yeah.
How can we make our organization and more organizations be more friendly and more receptive, have more immediate availability? So if a loved one of yours needed help, it doesn't help when you say, well, the intake appointment is 4 months away.
Right.
What are we supposed to do in those 4 months?
Yeah.
So the ability to have timely help when it's needed, I again say a stitch in time saves 9. We want to have a model where we can take care of our own patients without them having to go to the urgent cares or ERs as much as possible. And we want to build off of this family at Nevada Mental Health at all levels, into our support function, into our psychiatrists and APRNs, and just continue to serve this community where we can really truly elevate Nevada's level of mental health, that we look like a city that we are.
Right.
And our mental health right now we're in a lopsided state of affairs.
Yeah, and it's tough, but the fact that you're here and you feel like you're making a difference every day with the patients who are coming in to see you, right?
Yeah.
Yeah.
No, and that's where, building off of what Sid said, is moving from kind of a triage approach of there's not enough and there's so many, let's do a little bit of something to get folks by, of investing in the next generations of providers and teaching skills that aren't just
that's critical.
triage skills of how do you build a more meaningful, robust treatment intervention, because then you decrease the burden on the other parts of the system. And so it's been a steady, consistent growth for us, and I think we focus on our core. That's probably the most rewarding thing. We're talking about entrepreneurs, and we were new to business when we did this.
Yeah.
And you got to keep your lights on, but I think on our end we focus on a quality service and interaction, and the business part kind of takes care of itself, which has been nice. And so I would say for anyone, on that standpoint, believe in what you do and approach it with ethics and thoughtfulness, and I think it'll work out for you.
Yeah, because that sounds like, and like I said, when it comes to, secret of your success and what makes it work, obviously you do have people who need you. So the patients are out there, the customers are out there, but it's how you operate your business every day that makes the difference. And when you see your patients, it's more than, it's than just running that practice, right? I mean, you're helping each person that comes through your door.
Yep. So I will say to anybody who's looking to get into the idea of owning a business which is linked to healthcare, take care of your patient. If your patient gets well, everything else will take care of itself.
Yeah.
So we always, when owning a business in health or mental health, you're always towing the line between the practice of medicine and the business of medicine.
Yeah.
And we always want to lean towards the practice of medicine. If that goes well, the business of medicine will take care of itself.
Yeah, that's a great way of putting it. And Tim, talk to us about if people need your help and want to reach out, what's the best way?
The easiest way is probably to go to our website, nevadamentalhealth.com. The whole thing just spelt out.
Yep.
It's hopefully not a too complicated website. It kind of walks through some of our
and
core principles.
And it lays out the information pretty well of what services you offer and all those things, right?
And our phone number is there, so you can call. There's also on the top, I think the right-hand button is a register now. It's the quickest way to kind of get your information in our system into our intake coordinators, and they should reach out within hopefully one business day, if not two, and then we should be able to get you scheduled. And our goal, we try not, I think we try and get people in within the first, couple of days, couple of weeks, rather than months. And so our website's got the easy information on there. So
yeah, and you're growing, right? Said you're trying to get more psychiatrists in-house.
More and more people are hearing about us.
Yeah.
More people want to receive their care from us, and more people want to join the team. So this is really good to see it just come together the way we had imagined it to be.
Right. Well, we love to hear good news, and you're all doing great things for the community. So thank you so much for coming on the show and sharing a bit of your story with us. And I'm sure people will take away anything that think a little bit about their mental health, especially on this month.
Well, thanks for having us. It's been a pleasure.
Thank you so much. And thank you so much for watching this episode, and we'll see you again next time.